About 250,000 people have now been tested for the virus all over the state of New York. 18,000 tests were done just yesterday alone. Most of that, though, happening downstate. So what is the status of testing here in Western New York? 7 Eyewitness News reporter Nikki Dementri has some answers tonight.
New York is testing for COVID-19 more than any other state in the country. At least 238,000 people across the state have undergone testing for the virus. Less than half of those are positive.
I don't think we'll ever have the capacity to test every single resident of the state of New York. That would literally take, if we did 1 million a day, that would take almost 20 days straight of nothing but testing, and that's just not possible.
New York Lieutenant Governor Kathy Hochul says the state is doing its very best to ensure those who need a test get a test. But she says it's important to prioritize those on the front lines like healthcare workers, and that's who's on the short list for testing in Erie County.
In Erie County, our testing hasn't been widespread. We would like more widespread testing, but as of this point, we haven't quite had it yet.
On Thursday, Dr. Gail Burstein says Erie County has tested more than 2,000 people.
People in Erie County are getting tested. So we only have a finite number of tests right now. Hopefully that won't be the case forever.
To compare, as of Wednesday, the Erie County executive tweeted 2,210 residents have been tested. Just down the 90, Onondaga County tested 1,500 more residents, yet has about half the population.
We've been doing robust testing. That number is larger than many counties that are larger than us.
We have to work within the reality, and the reality is that there is a limited number, a finite number of tests for the time being, and therefore we have prioritized them the way the CDC has recommended.
Infectious diseases expert Dr. Thomas Russo says from a medical standpoint, most will self-resolve from this illness, so it's important those individuals stay at home, isolated, to help limit the spread to others who may not be able to fight the virus as well.
Strategy in this less than excellent situation that we've adopted is at least working for us. We're doing the best we can with what we have.
Dr. Russo says it's a lack of reagents and nasal swabs limiting the county's ability to test, and officials agree, blaming it on a stockpile issue.
If we had more testing available, we would test more of other essential employees.
At some point, we'll be able to restore the stockpiles that we should have had in the first place, but the federal government never sent out the alarm early enough to have mass production.
Nikki Dementri, 7 Eyewitness News.